Transplant coronary artery disease, also known as cardiac allograft vasculopathy, is a unique and aggressive form of coronary artery disease that occurs in the transplanted heart. It remains the leading cause of late graft failure and death in heart transplant recipients. Unlike standard coronary artery disease with atherosclerosis, which typically presents as focal eccentric plaques, transplant coronary artery disease is characterized by concentric diffuse intimal thickening that often involves the entire length of both epicardial and intramyocardial vessels. As the transplanted heart is denervated, the nerves were severed during surgery. Patients typically do not feel angina or chest pain. Symptoms, if they occur, are often non-specific, such as unusual fatigue or shortness of breath, nausea or stomach discomfort. They may also present with sudden heart failure, arrhythmias, sudden death, or silent myocardial infarction. Severe diastolic dysfunction with normal left ventricular ejection fraction can occur due to microvasculopathy or small vessel disease. Pathology is primarily due to an immunological phenomenon. Recipient's immune system causes chronic injury to the donor heart's endothelium. This triggers a reparative process where smooth muscle cells and fibroblasts proliferate, gradually narrowing the vessel lumen. Risk factors: immunologic, HLA mismatch, frequency of acute rejection episodes, and cytomegalovirus infection. Non-immunologic: older donor age, hypertension, diabetes, and dyslipidemia. Standard coronary angiography often underestimates the severity of transplant coronary artery disease because the narrowing is so uniform. Intravascular ultrasound or IVUS is considered the most sensitive tool for early detection. It can measure the actual thickness of the arterial wall. The International Society for Heart and Lung Transplantation classifies CAV into 4 grades based on angiography. Here's a simplified description for ease of remembering. CAV 0, there is no detectable cardiac allograft vasculopathy. CAV 1, mild, left main stenosis less than 50%, other vessels less than 70% without allograft dysfunction. CAV 2, moderate, left main less than 50%, single primary vessel or branch stenosis more than or equal to 70%, again without allograft dysfunction. CAV 3, severe, left main stenosis 50% or more, or 2 or more primary vessels 70% or more stenosis, or isolated branch stenosis 70% or more in all 3 systems, or previous grades, that is a CAV 1-2 with allograft systolic dysfunction with left ventricular ejection fraction 45% or less, usually associated with regional wall motion abnormality, or evidence of significant restrictive physiology. Prevention is by aggressive control of lipids. Statins are often started early post-transplant regardless of cholesterol levels and blood pressure control. Then immunosuppression adjustment. Switching to mammalian target of rapamycin mTOR inhibitors like sirolimus or everolimus have been shown to slow the progression of intimal thickening. Stents or bypass surgery are difficult because the disease is so diffuse, but they may be used for focal lesions. Retransplantation is the only definitive treatment for severe end-stage transplant coronary artery disease. Finally, a word about donor-transmitted coronary artery disease in heart transplant recipients. Heart transplantation donor profile has changed recently due to supply-demand mismatch. older age, more comorbidities, higher frequency of non-traumatic cause of death, hepatitis C positive donors, and donation after circulatory death have been reported recently. This has led to the possibility of transmission of silent coronary artery disease from the donor. Though consensus documents recommend donor coronary angiography for older donors before procurement, there are practical limitations to this approach. Significant donor-transmitted coronary artery disease has been associated with increased risk of cardiovascular death and major adverse cardiovascular events or MACE, typically including cardiovascular death, non-fatal myocardial infarction, and non-fatal stroke.